Hey everybody, Dr. Mac here in Beverly Hills. Hope you're having a fantastic day. We've been talking some in the past about the new Pixel 8 microneedling radiofrequency device. Well, what we always like with devices such as this, as well as whether it also be surgical facelifts or rhinoplasty or for hair restoration, we love our platelet-rich plasma. So that is a regenerative product. It is from your own blood plasma, and it involves harvesting through a very simple blood draw of just one or several tubes, depending on how many we want to use for the rejuvenative effects. Then placing that test tube and your blood within a centrifuge system, it concentrates and separates your platelets and your serum from some of the other blood elements that are more inflammation causing. Platelets themselves have multiple growth factors, at least 7 to 9, and more being discovered every day, of proteins that minimize inflammation. They have what's called a cytokine effect, and cytokines are the proteins that then talk to your body, cell to cell, what's called paracrine communication, and then also what's called chemotaxis enhancing. And chemotaxis, like the suffix part of the word says, taxis is where we get taxi from in the English language. That is a transportation mode. So these cytokines that are present within your platelets that are released when they're injected wherever in the body we want to utilize them, tell your immune system to come and perform regenerative effects there. So with PRP, we utilize it after a microneedling sort of session, whether it has power such as the Pixel 8 or just general microneedling by itself, to enhance the body's response to collagen growth in the fibroblasts of the face or the arms or the stretch marks wherever we're going. If we're looking to do a rejuvenative effect for hair growth, then we can inject this platelet-rich plasma directly into the scalp. And there, those signaling, talking proteins can speak to your own hair fiber producing stem cells in the follicle to be more biologically active, to enhance the growth of the keratin shaft, what we see on top, to be stronger, larger, thicker, faster in growth quality, and have a longer expansion of the growth phase, the anagen phase that we want to have going on, where the hair is growing actively before it goes into a dormant type phase, such as with telogen or catagen. So platelet-rich plasma, you got it, I got it. People are always saying, but I don't know if I want to use my platelets, which is really all we can use and would want to use, because I'm so many years old and my platelets are old. Well, no, they're not. The nice thing about platelet biology is platelets are never old in your body. Platelets circulate around approximately 2 weeks, and then they're filtered out in your spleen. The reason being, as the platelets circulate around, then they can develop a little bit of roughness on their margins just by flowing through your capillaries and arteries for miles and miles and hundreds and thousands of miles of circulation through your body. If they get too rough and beat up, kind of like being on the 405 on a trafficy day in your car, if they get too rough and beat up, then there is always the potential for them to clump together and form a clot. And that's called a stroke or a heart attack. Not good things to have happen. So that's where the body has the spleen to help be its filter, so that the rough or older platelets get screened away, and our bone marrow is always creating and renewing our platelet volume. So your platelets are always young. They're always fresh, they're always viable, and beneficial to rejuvenative effects and regenerative effects throughout your body where we can place them. Hope you're having a great day. Look forward to seeing you soon. Take care.